Scrambling to deal with the flu outbreak, hospitals around the nation are taking some extreme emergency responses to deal with a swarm of patients. And we have a doctor here to talk about what you need to do if you are feeling sick with the flu. But first, we've got some pictures for you now from Lehigh Valley Cedar Crest Hospital near Philadelphia, where they're actually setting up a flu triage there. You can see these are actually special tents located right outside its emergency room. The hospital says it's safer for patients and staff if there's a spot where everyone can wear masks and stay protected. The hospital, by the way, did something similar during the H1N1 flu outbreak a few years ago. And Dr. Shaun Jayakar is here now from the Internal Medicine Department at St. John Hospital. And Doctor, thank you for being with us.
Thank you.
We are also hearing today at least 3 hospitals in Chicago are so full that they're actually taking patients in ambulances and taking them to other hospitals. Just to allay people's fears, first of all, this is not yet that serious in our area, but we're still seeing an outbreak that hospitals are preparing for and dealing with right now.
Oh, we're seeing a definite increased number of flu cases in the office. People are coming with body aches, fever, malaise, where they just can't get out of bed. And it's important, if you do have these symptoms, to go see your doctor as soon as possible, because we have antiviral drugs we can prescribe that can shorten the duration of the illness and make you get better faster.
What we're finding in some of these places, in these hospitals we're talking about, is that people are showing up to the ER. I think a question people may have is, okay, maybe you go to the doctor because you don't feel good. When do you know when either you just stay home and you're doing okay, or when do you need to go to the ER to be seen again?
If you start having breathing difficulties, you very well could be having primary influenza pneumonia, and at that point you should go to the ER in case you need breathing treatments, IV fluids, that sort of treatment that can't be given at home.
But even if you don't, if you're just starting, it's important to see a doctor because of these antiviral drugs.
Absolutely.
Like Tamiflu that you can get on to prevent complications.
If you're able to see a doctor within 48 hours of getting the symptoms, these drugs can work, can shorten the duration of the illness and make you feel better.
Who's most at risk of complications from the flu?
Pregnant women, those less than 2 years of age, and senior citizens, and those in nursing homes, and obviously those who already have pre-existing conditions such as COPD, lung diseases, cancer, heart disease.
All right, Dr. Jayakar, something we have to take very seriously. I know the flu shot works the best to prevent the whole thing,
Absolutely.
so we can't really say that enough. Thank you so much for taking the time to talk to us
thank
today.
you.
Stephen.